Hello, I am Dr. Randeep Singh. I am a cancer specialist at Narayana Super Speciality Hospital, Gurugram. We will be talking about colon cancer, and as we all know, colon is also a term used scientifically for large intestine. There is some rise in our country. This is one of the very common cancer in eastern countries as well as in America, but in India also there is a rise in colon cancer, and some things can this be attributed to change in the lifestyle, less roughage diet and taking more of junk food, obesity or overweight, as well as a very small percentage of colon cancers can be due to hereditary, or we call it as genetic in origin. Maybe around 5 to 10% can be due to abnormal genes, but majorly it is considered as a lifestyle disorder. The usual symptoms are very vague, and sometimes it is very difficult to diagnose these cancers early. These tumors may just cause a small amount of bleed in stool, which can lead to low hemoglobin or anemia. Sometimes they grow and obstruct the pathway of the stool and lead to increase in the size of the tummy as well as pain in the tummy. They can lead to weight loss, loss of appetite, but all these symptoms are vague. But sometimes if you are lucky to have it detected early by these signs and symptoms, or you go to the physician and tell these signs and symptoms and he picks up them and investigate them, you may be diagnosed to have this tumor. One of the common method which is helpful in diagnosis is called colonoscopy. This is long telescope which is passed through the anus into the intestine by a few centimeters, and they check the gastroenterologist checks the whole tube, and if they find something abnormal, they do the biopsy of the tumor, and if it is cancerous or there is a colon or large intestine cancer, we do CT scans and see the spread. Generally, after the diagnosis happens, most of the time colon cancer is restricted to the large intestine and it is treated by surgery. Almost 50-60% of the patients at treatment are able to undergo surgery in this tumor. Once the tumor is resected out, or the intestine and the defective part is removed, few or a large significant number of the patients do require chemotherapy, and this chemotherapy goes for around 6 months to 8 months, and it is in the form of either oral tablets or oral chemotherapy called capecitabine, as well as it is in the form of injections which are given every 15 days for next 6 months, and they are also given on daycare basis or while you have to be admitted. These chemotherapy regimens are tolerable, and even elderly patients more than the age of 70-75 can also tolerate these regimens easily. Sometimes unfortunately, when we are diagnosed with colon cancer, it is already spread to the other parts of the body, and then we use only chemotherapy with or without the combination of targeted therapies such as bevacizumab or Avastin and cetuximab or Erbitux. So friends, be cautious, and there is also a technique called screening colonoscopy done in healthy individuals, where we do colonoscopy once in 10 years so as to diagnose this cancer at an early stage or precancerous. I hope this information is helpful, and thank you.